Janavana here again, and thank you for coming back to my YouTube channel. We are still at the Sculptra Launch, and I am super excited to be chatting to in person my friend Dr. Musarrath Raboobee. We always have these long, super long conversations on Instagram DM, even though we have each other's number. So I'm so glad to be chatting to you in person.
Thanks so much, Anjana.
Yeah, and then she has so much knowledge on so many different things, you know, derm related as well as aesthetically related. And I know one of your favorite treatments are threads, PDO threads.
Threads are my favorite treatments, PDO threads and PCL threads.
Okay, all right.
I love them both. They're so minimally invasive.
Yes.
So safe technically compared to a lot of other treatments out there, and you know, minimal downtime as well, and that's why I love them.
So how do you choose between PDO and polylactic? So which one do you prefer, or like when would you choose one?
Yes. So I think, you know, that's a good question, because there are a lot of different types of threads, and so the selection of the thread depends on what you're looking to achieve in the patient.
Okay.
So if you're looking for some collagen stimulation,
yes,
you will choose smooth, simple PDO threads or screw PDO threads.
Yes.
And if you're looking for more of a lift, you want a barbed thread that can also be PDO, or you can get a barbed PCL or polylactic acid thread. And those are more for lifting, so it just depends what your patient is looking for and if you can achieve that in your patient with a PDO or PCL thread.
Okay, and then you know, an important point to note is that I know this is going to sound strange, but if you're a thread lift candidate or you're interested in thread lifts, I always say you have to really make yourself mentally and emotionally strong. You have to be the right person, not physically only, but also in your head. You have to be, because it looks glam and all of that on social media, but there is a bit of a recovery period. But it like you said, it's safe. Some really great results. I know not everyone is a fan,
I think
but
people think it looks very painful. Firstly,
yes, but it isn't. It isn't actually.
Videos. It's not as painful as you would think if you are numbed correctly. And then for the smooth and basic PDO threads, there's much less downtime compared to the PCL, PLLA.
Yes,
where there is much more downtime, and you do have to prepare the patients for that downtime. But you know, smooth, simple threads, having a few of those every few months can really stimulate collagen, can do a lot to boost your skin. They're not as painful, and there's much less downtime comparatively.
And then for you, what is your most satisfying treatment that you've
the nose lift? Yes, the nose thread lift, absolute favorite, instant results. That perfect nose, and the patient is so happy. You see their satisfaction immediately.
Yes,
and that gives me satisfaction.
Yes, I also love nose threads. I find them also. I know nothing should be easy. We always have to be conscious about what we're doing, but it's also not very difficult or strenuous treatment to do, relatively safe, especially with fillers. Not like, you know, if you know what you're doing in terms of fillers, it's great, but there's always the risk of migration with fillers,
vascular problems.
Yeah, so that's a very dangerous, you know, side effect of like nose filler. But the other thing is there's also stuff that can go wrong with threads. So with you know, I've seen a couple of things, extrusions, or they skew, or a bit of an infection. So you know, you really have to know what you're doing when you do some thread treatments.
You need to prepare the patient very well before the procedure, and the aftercare must match that.
And then another thing you are very well versed on is vitiligo. Am I saying, you know, so some people say vitiligo, some people are like vitiligo. What do you say?
Vitiligo.
Yes.
Okay.
Yes.
This is now my dad's passion that I've inherited.
Yes.
Vitiligo, it's an autoimmune condition. It's actually quite common. 1% of the population has vitiligo, and it's becoming more seen now because of models like
Winnie Harlow.
Winnie Harlow. She's a model, and she's bringing vitiligo to the forefront of skin conditions.
Yes.
So more and more patients are coming forward with vitiligo. Some don't want any treatment for it. They're happy to embrace their spots and embrace their skin and be happy in their own skin. And some really do want treatment, especially children.
Yes.
Children, it really affects their self-confidence, you know, in a school-age person. Yeah. So there are a lot of treatments available for vitiligo.
Yes.
Both non-surgical and surgical. And we definitely can offer those treatments to patients.
Okay. And the latest would be stem cells? latest, right?
The latest is
No.
cultured and non-cultured melanocyte grafting.
Okay,
It's
all
a
right.
surgical technique for vitiligo.
Okay.
There's also punch grafting that we do in office. We
Yes.
do all these treatments in office.
Yes.
And excimer laser, another
Oh yes,
excellent
yes,
treatment.
yes. You know, vitiligo is actually something, well, I suppose close to my heart. It's nothing that I've ever been bothered about, but I know it's very common in the Indian population. And actually my mom, I would say, suffers with it. And as she was growing up, obviously it gave her issues, but then she turned completely one color. She's completely white. And I know when I was in school, I went to, and if you know the history of South Africa, apartheid and whatever, but I went to a mixed race school and people would be like, what are you? You know, because they'd see my dad and they'd see my mom. And I was just so used to my mother looking that way as when I was growing up, and having a few friends like that, having some colleagues on campus. So it's exceptionally common, actually. Yeah. And it's really nice that there are models like Winnie Harlow, you know, making it seem like normalizing it. Yeah. Okay, but thanks, Ross. I'm so glad to see you in person, and we're going to go chat some more off camera, have our coffee before the launch actually starts. So thanks, guys, for joining us. If you have any questions, drop them down in the comments. Muss is in Durban. If you guys are in Durban and you want to look up somebody who does thread, some information about some derm conditions as well. So yes, drop them in the comments. Look Dr. Raboobee up and like, share, and subscribe. Thanks, guys. Bye-bye.